Hello, I'm Dr. Bang, the hair magician who protects your hair. It's a pleasure to see you. Today, I'd like to discuss female hairline transplants, specifically focusing on cases where the same hair volume was transplanted, yet the resulting hairlines have a distinct appearance. We will examine where the differences occurred and how those differences manifest as changes in appearance. To begin, both individuals underwent hair transplants of about 2,600 grafts, and both were women in their mid-20s, yet their desired results and expectations varied significantly. One patient desired a much clearer, denser, and more perfectly rounded hairline, whereas the other patient specifically requested a hair transplant so subtle and natural that absolutely no one would be able to detect it. First, looking at the photo of the person who wanted a rounded forehead, the issue was the concern that her forehead would become too narrow. If the forehead is too small, the face can look relatively larger, so adjusting the height was more difficult. So after setting a certain height, you'll know that to make the front of the hairline round, the transplant needs to be done in a band shape, like a headband. On the inside, of course, I implanted thicker, stronger hair. As you can see from the transplant photo, I maintained a dense inner area by transplanting a greater number of medium to thick hairs. For the thin hair, I only implanted what I usually describe as 3 to 4 rows. When you transplant like that, the thin hair transitions directly into the dense hairline. The benefit of this planting is a perfectly round hairline from any angle. However, one potential downside when receiving a hair transplant like this is that the hairline might appear coarser or darker compared to the surrounding hair, creating a subtle, unnatural feeling upon closer inspection. Through my many revision surgery consultations, I've come to realize that if thick hair strands emerge, the most effective approach is to extract them and then re-implant them in the front. Attempting laser hair removal or applying topical creams will not achieve the natural aesthetic that the patient truly desires. When you see the results after about 6 or 7 months, you might feel a bit of regret. We succeeded in creating a round and aesthetically pleasing forehead, but this approach can result in a somewhat less natural appearance. Now for the opposite case, what this patient wanted was a procedure that even her family wouldn't know about. Why? She was insecure about it, but she hated the idea of it being obvious to others that she had surgery. So in cases like this, we design it to not be overly round, as you can see in the design photo. I do tell the patient that if they pull all their hair back, there might be parts that look a little angular or sparse. However, I also assure her that we can achieve a natural appearance that is significantly fuller than it was previously. When transplanting, we also need to implant more thin hairs, making the area denser. While before we might have planted 3 to 4 rows, here we plant 8 or 9 rows of thin hair, maybe even up to 15 in some spots. This makes that specific area look relatively lighter and somewhat less dense, which helps in creating a natural aesthetic. However, the downside is that it might appear a bit emptier when exposed to bright lighting. If you look at the transplant photo, you can see we planted thick hair inside the border and all thin hair at the very front. When transplanted in this manner, thin hair typically tends to grow out a bit quicker, so even after only 3 months, that particular area will appear as natural, fine hairs. There are cases where, if I'm a bit too ambitious, some people find a very distinct and clear hairline attractive. However, for others, this can create a strong sense of rejection. In cases like these, if you lower your expectations a bit and we plant more fine hairs, we can create a more natural hairline. But what's interesting is that both patients received almost the same amount of transplanted hair. So patients can get confused. They might think, don't you need to implant less if it's thin hair? But that's not the case. In fact, the thinner the hair, the more hair volume is often needed. So, by truly grasping this aspect, pondering the exact appearance you desire, and then proceeding with a consultation and deciding on the surgery, I believe you'll achieve a far more satisfying result. Today, we've explored hairline correction procedures in more detail. I hope you consider this carefully, consult, and achieve good results. Thank you.